Welcome, welcome. Good morning, good evening, and a very beautiful namaste to all the people who are watching us live. Welcome, dobro doshli, dobro doide, and dobro din. To all the beautiful and pious souls who are there with us, who will be there with us. And today, in this global conference of phytomedicine as an adjuvant therapy in the treatment of sickle cell anemia by none other than Macedonian Association, Doza Sregza International, and Sickle Cell Intervention International UK. Since ancient times, we are using herbal medicines. These are also called as phytomedicines, which are the mixtures of plant metabolites that contain pharmacologically active compounds that exhibit some therapeutic properties. And that today we are going to get this witness in a very insightful wisdom journey in this global conference. So without taking any pause, any break, let's take a deep dive in our journey today. And now I would express my heartfelt gratitude and call upon to the first speaker and to also that great personality who believes in one thing, and I will say only one thing about him. If I am not wrong, then who believes ona stogo pravime denes ostanuva vo vechnosta. So, international representative of Macedonian Association, Doza Sregza International, who has proved a big milestone in the field of research and development, phytomedicine, a scientist, educator, speaker, author, none other than Dr. Dragan Jovanov. Status all yours.
Thank you very much. Hello, Supri. Greetings to Dr. Elizabeth. Greetings, Anuja. Bestest team in the world. Hello, everyone. Thank you for being a part of our global conference today, which aims to support an initiative to support people with sickle cell anemia. I will speak briefly about this health problem. I will list with medical plans can help. For more information, I will leave a contact number and email or write to me on my profile on social networks. And I will leave room for other colleagues to say something more. Sickle cell anemia is a genitally inherited diseases in which the CC individual possesses an abdominal beta globulin gene. A single base substitution in the gene encoding the human B globulin subnet result in a replacement of B6 glutamic acid by valine, leading to the devastating clinical manifestation of sickle cell diseases. This substitution causes drastic reduction in the solubility of sickle cell hemoglobin when deoxygenated. Under these conditions, these molecules polymers to form long crystalline intercellular mass of fibers, which are responsible for the deformation of the biconcave disc-shaped erythrocyte into the sickle sharp. First-line clinical management of sickle cell anemia included use of hydroxyurea, folic acid, amino acid, supplementation, penicillin prophylaxis, and antimalarial prophylaxis to manage the condition and blood transformation to stabilize the patient's hemoglobin level. These are quite expensive and have attended risk factors. However, a bright ray of hope involving research into the anti-skilling properties of medical plants has been rewarding. This phytomedicine therapy using has proven to not only reduce crisis but also reverse seeking in vitro. I have researched so far this herbal plant that help with the health problem. There are others, but I leave room for working together with everyone who has such a problem. Herbal plant for help it, sickle cell anemia, nettle, rosemary, Thymus serpulum, aronia, chamomile, blueberry, and papaya. Thank you so much. Greetings from Macedonia.
Excellent, Dr. Dragon. There is no word for you what I should say about your insightful and impeccable knowledge. Thank you so much for reviving such a great way about sickle cell anemia, about how to do, and in a very great, you spoke about the phytomedicines. So keep soaring high, keep enriching the world, and of course, you're an inspiration to the world that everybody knows. So thank you so much for your insightful, invaluable. I must say that there is no words is left to listen and to cherish you more. So thank you so much once again. Well, moving to my beautiful journey of beautiful, you can say, about sickle cell, which so many people are very curious to know. Now, a great profound pleasure in calling my next eminent speaker from UK, Counselor Professor Augusta Elizabeth Koroma, Founder, CEO, and Director of Sickle Cell Intervention and Africa Sickle Cell Intervention. Please welcome Professor, the stage is all yours.
Wow, good afternoon, good evening, good morning, wherever you are. It's so welcoming, Dr. Supriya. Thank you, Dr. Dragon, for that introduction. Great, profound, as you speak there in terms of sickle cell disease, really. Welcome, everybody. It's a great day to be here to talk about phytomedicine as adjuvant therapy in the treatment of sickle cell anemia. How can I just highlight that tomorrow is World Sickle Cells Day, June 19, which is celebrated throughout the world. So we are actually celebrating it today. So I hope tomorrow you guys can support sickle cell intervention, sickle cell World Sickle Cells Day by putting on certain gestures on your social platforms to commemorate the day, actually. I don't know if I can see if I can do my screen in here, share something with you guys.
You can, you're the co-host, you can.
Okay, right. It's taking its time. Okay. Right. Can you see my screen?
Yes, we can.
Okay. Right. Okay. Right. Here we go. Yes, thank you for that introduction. I'm Counselor Professor Dr. Augusta Elizabeth Koroma, all the way from the United Kingdom, the CEO, founder of Sickle Cell Intervention International UK and Africa Sickle Cell Center for Education and Research, Sierra Leone and the Gambia. Welcome, everybody. What is sickle cell disease? Some of you know what is sickle cell disease, and some of you might not know what is sickle cell disease. Dr. Dragon has just highlighted, about sickle cell disease. Sickle cell disorder is a hereditary condition that affects the red blood cells. In sickle cell anemia, the abnormal hemoglobin causes red blood cells to become unwavering sticky and can lead to stroke, acute chest syndrome, pulmonary hypertension, organ damage. Worst cases can even lead to death. The disorder is common in sub-Saharan Africa, the Mediterranean areas, Arabian Peninsula, South Asia, and Southern Asia. What is the therapeutic potential in phytomedicines? According to a study by Onyanga et al. In 2022, what he stated was, it was clearly pointed out that lots of obstacles and a lower life assumption and link with sickle cell disorder. Phytomedicines medicines derived from plants in their original state. People with sickle cell disease may come across them in terms of plant remedies from traditional herbs, healers. Other researchers' controlled trials have emphasized the need for phytomedicines in sickle cell disorder, from Akinsul 2005 and Ajua 2009. All these research studies have highlighted this in terms of phytomedicine. Not much studies have been done on phytomedicine and sickle cell disorder. I'll tell you that. According to another research by Famando in 2017, she narrated about the cost of treatment in sickle cell disorder and further stated that it is wiser to investigate therapeutic potential of indigenous plants because they could contain molecules with beneficial properties. So what are the symptoms of sickle cell anemia? Anemia, chest pain, which results in difficulty in breathing, abnormal pain, joint pain, swelling in the hands and feet, slow growth and development in infant children, delayed puberty in teenagers. There is blockage of blood flow to the spleen and liver also. Sickle cell anemia symptoms usually include a number of the following. The first one, I'll say, fatigue and weaknesses. And that even happens to people that have the trait, not only people that have the disease of itself. Symptoms of a fever, swelling and fluid retention, shortness of breath and chest pain, which can make it difficult to exercise or be active. Joints and bone pains, especially in the long bones, such as those in the extremities. Problems with bone marrow, especially in the hands and feet, can cause bone pain. Abnormal pains, vision problems, nausea, vomiting, digestive issues, upsets, poor circulation to the skin that causes soreness. And symptoms of jaundice. It's common for people with sickle cell disease to have jaundice, which the yellow of the eyes, which causes symptoms like yellowing of the skin, yellow of the eyes, enlargement of the spleen, including during childhood, which over time can cause the spleen to become damaged or shrunken. Higher risk for infection and illnesses, including pneumococcal pneumonia, partially due to the spleen not working properly. Higher risk for blood clots due to blocked blood vessels. Nutrient deficiency, and I'm sure we have Claudine Matthews, who is going to explain more in terms of this, as I'm just highlighting issues in terms of nutrient deficiency. Of all the sickle cell disease, sickle cell anemia tends to cause the most severe symptoms, limitations and disability. As from now, there is no cure for sickle cell anemia. However, there are lots of treatment options, universal cure, lots of options for managing symptoms and reducing complications, including infections, fever, kidney dysfunction, and others. Many people with sickle cell anemia or other types of sickle cell disease develop nutrient deficiencies due to problems with absorptions and digestion in general. So according to a study in 2010, reports published in the journal Nutrition and Metabolic Insight, it has become clearer that recommendation dietary allowances, RDAS, for the general population are insufficient for the sickle cell patients. A significant percentage of sickle cell anemia patients will deal with deficiency in nutrients, including iron, zinc, copper, folic acid, pyridoxine, vitamin D, vitamin E. A well-rounded nutrient-dense diet is important for preventing complications due to sickle cell anemia, and as such growth and development abnormalities, decreased bone density, higher risk for fractures, vision problems, higher susceptible infections, and others. In conclusion, what I will say, when to visit your doctor, sickle cell anemia has the serious health hazards, like permanent damage to brain, heart, liver, kidneys, and bones. So it is mandatory to visit your doctor during these symptoms. Severe pain in abdomen, chest, and joints. People who have severe sickle cell anemia are the increase of risk of infection is the first symptom, really, in terms of that. Pale skin, one-side paralysis and weakness in arms, leg, difficulty in walking and problem in vision, then call your doctor immediately. So today, actually, in Africa, well, tomorrow, really, in West Africa, for the manager, in fact, is on this line. The theme for tomorrow for sickle cell disease is June 19. Our theme for this year for Africa Sickle Cell Center for Education and Research is why newborn screening should be a priority in Sierra Leone on sickle cell disorder. The burden and global distribution of sickle cell disease should be priority worldwide. Nevertheless, improving the profile of sickle cell disease as a major health problem worldwide, including the introduction of newborn screening programs and the improved provision of even the most basic medical care, will benefit the greatest number of patients with sickle cell disease worldwide. Sickle cell disease is one of the common and fast-growing genetic disorder in Sierra Leone. During my visit to Sierra Leone in 2020-21, I noticed that this disorder continues to multiply rapidly and growing. It's about time newborn screening is implemented and its necessary steps are not taken. Sickle cell disorder will become the most rampant public health problems in Sierra Leone. Sickle cell intervention UK and Ask for Our Sierra Leone hosted a psychological intervention for children suffering from sickle cell disorder. Sickle cell disorder has a major social and economic implication for the affected child as well as the family. Recurrent sickle cell crisis interferes with the patients, especially with regards to education, work, psychosocial development. So in Sierra Leone, the prevalence rate of the disease is about 24%, similar to 1 in 4 other West African states like Nigeria, Ghana, and all of that. So 20 to 45% rate is found in sub-Saharan Africa, in countries such as Cameroon and all of that. So that's why we are doing, in terms of Sierra Leone, we are doing the newborn screening. In terms of sickle cell intervention in the UK, we are teaming up, some of you might not know, I'm the director of public health in terms of the European Sickle Cell Federation in Ireland. I'm the director of health promotion. So we are actually teaming up in terms of blood donation, because we believe that donating blood is so important in terms of that. So we are all coming together in terms of focusing, and the theme for that is power in unity, power in numbers, working together to save lives. Thank you so much for listening to me here today. It's warm welcome to you all, respected individual, for this great platform. Thank you ever so much. It's World Sickle Cell Day tomorrow. Don't forget to patronize us on all your social media platforms. Thank you so much. God bless you all.
This is really, really informative, Dr. Augusta. And hats off to you for rendering such a, when we talk about sickle cell anemia, even I got scared what it should be in sickle cell, what we should study and what we should get. But the way you have told in such a lucid manner, it's really, really appreciable. And I congratulate you for your great future. God bless you and many more laurels and success on your way. So cheers
Thank you
to
so
you
much.
and to your beautiful presentation. Thank you so much.
Thank you. Thank you.
Well, moving to this beautiful journey of this global conference, now I would love to call my next speaker from, you will be amazed, from Uganda, Dr. Kim Bugvi Amans Michael from Uganda, Hubbless and CEO of Amans Sickle Cell Clinic and Amans Herbal Research Center Limited. Welcome, sir. The stage is all yours. Dr. Kim Bugvi, are you there?
He needs to unmute himself.
Yeah.
Hello. My fellow doctors, allow me to greet you in the name of our Lord Jesus Christ. Peace and love of God be with you. First of all, my name, I'm called Dr. Chimbwe Amas Michael. I'm a herbalist and a herbal researcher on sickle cells. And it's now 17 years treating sickle cells and making research on sickle cell disease. I started my research after visiting the hospitals because I am a church leader. I visited younger people, young children in the hospital. Then I found them that they suffering with the sickle cells. And I remember in my childhood, I was also a sickle cell warrior. Let me call myself a sickle cell warrior. So on that, I started making research how we can manage sickle cells, because here many people we have in our community, they are poor. Sometimes they don't have the ability of meeting or taking their children in the hospitals. That is why we decided to start working with them, helping them to bring hope to those who are lost hope from God, to treat them by using herbal medicine, the plants which are around us. I thank. Let me start with you, my sister, whom I'm seeing here, because you say that in the world we have many plants which we can use to manage sickle cell or to treat some different sicknesses or disease, but we have no way how we can find it. That is what I have read in what you've been wrote in your communication somewhere, somehow. There is also Madam, a doctor says, Dr. Priya, she also says that today in the world, people are there very busy on media, on their phones, on their computer, doing other things apart from how they can see, how do they relocate that day-to-day living, that they are busy abusing some people, doing everything on media. So for us here, amongst herbalist, amongst sickle cell clinic, we decided to engage ourselves in herbal medicine with the other professional doctors here in Uganda. Today, in Uganda, 20% of the Ugandan population has the genetic trait of sickle cell disease. 2,000 babies are born each year with a genetic of effect. The sickle cell disease is not curable, as our sister Koroma says. And however, it is defected area, the symptom can be reduced. The medicine I have, which is called sterile herbal medicine. At the time in 2011, I was doing my research on photochemical screening. Then the doctor said, the Ministry of Health says that this sterile herbal medicine, it has what we call alcohol salt, which can manage, they found that it managed to relieve pain that may associate with the sickle cell patients. On that, we decided to go with that. Then until when God helped us to find that cure, I, with you, my sisters, and my brother. My sister, my brothers, allow me to call you comrades. The medicine I have here, it has what we call alcohol salt, which is decrease blood lipids, which is lowers. It also has spodins, which decrease blood lipids and lower cancer risks, lower blood glucose response. But we also have plants where the spodins is where we found the spodins. The plants like broad beans, kidney beans, we have lentils, we have allium spice, we have things which is organic foods in our home. We have like garlic, we have onions, we have oats, we have spinach and sugar beet. We also have yam. That is where saponis is in the plants. We also have what we call tannis. Tannis, accelerates blood clotting. That tannin, which the things I'm talking here, it is in my medicine, the medicine we are using to treat, to manage, or to relieve sickle cells in sickle cell patients. It has tannis. The report says that it accelerates blood clotting, which it also reduces blood pressure. It decreases the serum lipid level, also reduce lung cancer. Okay, and we also have the plants where we can find or we can get tannins. The plants like eucalyptus or eucalyptus. Eucalyptus, allow me to welcome Ugandans who are watching me, because I have already sent them the link. The doctors, Ugandan doctors are here with us. Doctor, allow me to welcome you all who are watching us now today. Like Dr. Grace Nabata is watching us. Dr. Jamiro Mukwaya from National Drug is watching us. Dr. Jude, he's watching us. Dr. Henry Tunjuni, they are all watching us. They are with us. We welcome them. So we have what we call pollenoids. Pollenoids, like we find pollenoids in avocado fruit, or avocado batches, or avocado leaves. That is where we find those things. So I tried to extract. I tried to extract the brownie solution from these plants. Then after making them, I got what we call a stylo herbal solution. We have what we call morphine. My brother and my sisters, you know what we call morphine. Then morphine, we have a plant called the cannabis. In cannabis, we find cannabis in the, we find morphine in cannabis. So when do we use cannabis or marijuana? Sometimes we say green tea. We use marijuana or cannabis in green tea. Like when we bought the black tea here, we used to put something like 2 to 3 leaves of cannabis on marijuana, on our black tea. So my brothers and sisters, I thank you very much for calling us, for inviting me here. You are not inviting me only, you are inviting Ugandans. I taught my sister, Dr. Elizabeth Koroma Augustine, about what we call steaming. Steaming, there is a way of steaming foods we eat in our kitchen there. But we also have steam, like in coronavirus. In coronavirus, during the coronavirus period, many doctors, they encouraged the community to steam ourselves at home, because during that time, all the hospitals were full of people. So steaming was an easy way of treating ourselves from home. So let us first see what is the steaming of body. Steaming of body, it is a procedure that will put you in a state of relaxation and make your skin smooth, or more elastic, and cleanse and moisturized. Brothers and sisters, my fellow doctors, my fellow, let me say, the universe, we need to steam ourselves. Me here, Mama has just gone with his daughter, 7 years. I add steaming on people with sickle cell disease, because steaming cleans the skin. Steaming, it avails anti-aging. Steaming, it detoxes our body. Steaming, it helps us, it helps our body to relax. And lastly, steaming relieves tension. Also, steaming helps our body to waken up the nerves, because you see those people who are getting what you call attacks. We also called, let me use the word attacks. They get what you call blood clot. Blood clot. Blood clot comes when a person or a sickle, let me call a sickler, but in putting it together, let me say that blood clot comes when a person has no enough blood in the body, because a heart can't pump the blood well, because the body has no enough blood. So that steam, the warmth comes from the plants you boiled, then you cover a person in that worm with the plants. The worms comes and land on her or his body, and the body got a good worm. Then the blood starts moving faster, moving faster. So that means that all the vessels where the blood was stuck will go or leave. Then after steaming for like 5 minutes to 10 minutes, it depends the minutes you use. We also add on massaging their body. Because when you go in the hospital, the doctors encourage the guardian or the parents to those children or to those elders that when that person gets when that person gets the attacks, you use warm water on their bodies, so that when you pour, if you pour the warm water on their body, it means that the blood will run faster. So on that, we use steaming. After using steaming, we also had massaging on the treatment, because massage makes a person beautiful. The increased blood flows, the massage also increased blood flows, which improves the skin tones and reduce signs of aging. We know very well that people with sickle cells, their body don't grow well. Dr. Agustin has talked about it in his, let me say, education, in his educating, because she was educating us. She was impacting us knowledge. She was making us aware about sickle cells. So Dr. Agustin talked about it, about the skin, that person with sickle cells, she or he not grow well. So, because they normally use to use so many different tablets, different medicines, their skin become dry. Their skin become dry. They've been hydrated. So we add steaming and massage on their body, so that we open up or waking up their bodies to start reacting in a normal way. So massage makes people happy. After steaming, you also massage, you know. Then during a massage, the happiness hormones, serotonin and endorphins get released into bloodstream, combating feelings of depression. We know very much that people with sickle cells, they get what we call, they live all the time in a depression. Always they are not happy. Even the parents. I ever visited the hospital, the doctor was giving parents knowledge about sickle cells, and she says, please go with your child or with your baby, feed that baby, give him to drink, tea to drink, or whatever thing to drink, give him or her everything to eat, and wait until on her or his day of death. You know, which means that that message you deliver to the community, it traumatizes the parent. I'm not alone.
Sorry to interfere, Dr. Kimbugbi. We have another speaker also. So can you please take care of the timings?
All right.
Can you please wind up in 5 minutes, please? Our next speaker is also waiting.
All right, thank you very much. Thank you very much. Okay, I'm going to use like a 4 to 3 minutes. My sister, so even though that we know very much that there is no cure for sickle cell, but we have to use what is around us to manage sickle cell, to manage sickle cells. We use what we have. Though that people, me, I receive like 25 people to 30 people a day, every day. They come to use, we use what we have, because those people, they are really poor people. You know, that is why you use herbal medicine. We use the things we have around, and we thank God for that, because God is a brilliant man and wise to create us with what we have. Everything is prepared for us to use by God. We call upon you, doctors who are there, because in my country, we have many people, as I told you, that 2,000 babies every year, they born with these sickle cells. 20% died on the 5th birth, you know. So we call upon you that if God wishes, we need to get in hand, like how you did today, like how Dr. Augustine Koromo, you know, I like that name, Koromo, did. I see you doctors to come together, Uganda, India, Philippines, everywhere, to come in the corner to join one hands together. In 1 minute, I want to conclude with this. Last year, I was invited in one of the sickle cell day. Then the professor told us that they are planning for Guinness Land. Then after the doctor told us that we have to join up hands together to fight for people, or to see how people live. I thank you very much to come together. I thank you very much to recognize me, Dr. Mas Michael, and to recognize Uganda. I, with my heart, we shall serve the people of God. I thank you very much.
Thank you, doctor. I am really, spellbound. I was listening to you all, but still, when time was there, definitely we would love to listen to you more. You're insightful, you're invaluable. I must say it was very, very great to listen about the sickle cell, and you have a great knowledge. Today, you have enlightened the world with your profound knowledge. Thank you so much for great wisdom. Thank you so much.
You're welcome, doctor.
Well, after Uganda, it's time to move to India again and to listen our next dynamic speaker, none other than Dr. P.K. Rajput, former Senior VP and Vertical Head, Cadila Pharmaceuticals Limited Global, speaker, international life coach, and educator. Dr. P.K. Rajput, the floor is all yours, and we all are waiting to listen to you.
Thank you so much. Very, very good afternoon, good morning, and of course, good evening to all my Indian brothers and sisters here who are listening. Very happy to see Dr. Elizabeth after 1.5 years of time. Hi, Dr. Eliza. It was nice to see you. It was almost 1.5 years when we had a discussion on the sickle cell, when many things we have spoken about it. And once again, thank you, Dr. Supriya and Dr. Anuja Malik, for inviting me on this wonderful conference of Global Conference of Sickle Cell, where tomorrow means that is on 19th of the June, when we all celebrate and talk about the sickle cell, how to take care for this, because many of the people, they have suffered about it. And I understand, because when I was talking to Dr. Elizabeth, she told me about so many things about it. So I understand the pain, what is happening there, and what are the way which has to be taken care. And thank you, Dr. Kim Gogobe from Uganda, for having such a great elaboration of telling all the things. Very happy to see Professor Nada once again. You are omnipresent, Professor Nada. Just now we finished one of the meeting and then we jumped here together. Wow, what a great thing is there. So happy.
Yes.
And thank you, Dr. Dragon, for giving me this opportunity. Dr. Dia, yesterday we met on the same way, and very, very good evening to you. Assalamu alaikum to you from India. So nice people are here. And let me talk about one very, very important thing on this wonderful subject. When we talk about a wonderful subject, why do people suffer from sickle cell anemia? It is very, very important to understand, because we are from the pharmaceutical industry and 40 years I have completed there. So we have know about it. And what Dr. Elizabeth, she also said, it's basically a genetic disorder and is not caused by any external factors such as infection or injury. This is point number one. So it cannot happen with all, but it will happen to some of the people, which is very important. People which are suffering from the sickle cell anemia because they inherited a specific abnormal gene from their parents. That is the difference is there, because that will keep on going and going. And this abnormal gene causes the production of abnormal hemoglobin, not a normal hemoglobin. Yeah, resulting in the sickling of the red blood cells. It's not a smooth one. The sickling of the red blood cell will be like this, and then there is a problem is there. The sickle cell disease is more common among the people from the parts of the world where malaria is there, which is the people they suffer from the malaria part. That is another part which is very important. Again, in the African countries, in the Eastern countries, in the Asian countries, in India as well, this thing is happening there. And it is prevalent throughout, such as suburban Africa, which is a widespread area which is happening there. Now, the second point is phytomedicine. We are talking about it as a phytomedicine. So phytomedicine is an adjuvant therapy, and which is a basically herbal medicine, and which is a basically what just now doctor has said about it. It's a plant extract for the medicinal purpose. Yes, it helps also. It is a traditional form of the medicine which has been used for thousands of the years. It's not from today. Even in India, we used to use it. And same thing in Africa, they are also using it. And still the people, they use it. And continue to use the Ayurvedic medicine with extract. Because phytomedicine may involve the use of whole plant parts of the specific plant compound for the therapeutic effect. That is the beauty of that. It is being used, what just now doctor said, as a part of that alternative medicine. Now, like certain herbs and the plant extract, which has been shown to have anti-inflammatory and antioxidant properties, which can help to reduce the inflammation and oxidative stress associated with sickle cell disease. Because these are the basic problem of the people suffering this sickle cell. Pain is there, inflammation is there, people are not going to walk, and that's what doctor said, a lot of massage is required. There's a basic thing which is there in that. Additionally, there are some other plants are there which have the property that can help to reduce the pain or boost the immunity system, because when there is sickle cell anemia is there or sickle cell disease is there, the immunity system goes down. So the plants are going to help apart from the other medicine which are required. It is important at the same time to note that the phytomedicine should not be used as a substitute or conventional medical treatment. That you forget the medical treatment and only be there with the phytomedicine. And any use of the herbal medicine should be very well discussed with your doctor, which are knowledgeable doctor. Just now, by the way, doctor from Uganda was talking about it, that he has used it, he saw the effect of it, and now it can be there. So now coming to the cure rate of sickle cell anemia with the phytomedicine. The data says that it is a different type of the cure rates are there. Somewhere the doctor they found the right cure rate, because that depends upon the patient to patient. Because since it is acute therapy, it may help to alleviate some of the symptoms and complications associated with this condition, but it is unlikely to cure the disease. But it is going to help a lot, which is not helping getting help with any other part. it is equally important to note that the effectiveness of any treatment for the sickle cell disease can vary depending on the individual patient. I'm sure doctor will agree that some of the patients can get 90% of the effectiveness, and some patient can get just 20%, 30%, which even Dr. Elizabeth will also agree with this point. So phytomedicine should only be used as a complementary therapy, which is very important in a combination with the conventional therapy, because it will be a symbiotic effect will be there for the taking care of the sickle cell. So to ensure that one does not suffer from sickle cell, it is important to take precautions to prevent the transmission of the abnormal gene that causes the disease, which is very important, because as a medical people, we should be seeing about it. And that's why the work is happening in the different market, on the genome therapy, that how we should constrain that the transformation of the genomes to one side to the other side. That work is going on. And if there is a family history of sickle cell anemia, and if one person belongs to the population group which is at the high risk of the disease, genetic counseling and testing can determine, which may not happen in African countries, but the people from the Southwest Africa, or the people which are near to the area of the France and Paris or UK, they can go there and they can have their genetic profiling, which is going to help, which is very important, because it's a poor man disease also. That's what the doctor said. And some of the people which are the genetic problems are there, it's a people from the different quality of the people which are suffering with that. Now, if both the parents carry the sickle genes, there is a 25% chance that each of the children will inherit the disease. So taking the steps to prevent malaria infection is also very important, because we should not be there. So in general, maintaining a healthy lifestyle is very, very important for the person to take care. Coming to the conclusion part, because I have less time. So take this phytomedicine as an adjuvant therapy in sickle cell anemia, and certain plants are going to help. Phytomedicine should be used always as a complementary therapy in combination with conventional medical treatment under the complete medical doctor diagnosis, right? Go for the genetic profiling, which is very important, and counseling is very important. Genetic testing is very important, which takes steps to prevent malaria infection, maintain a healthy lifestyle, and regularly consult with a healthcare professional to manage any symptoms or complication with sickle cell anemia, so that it should not further add and a person should not be suffering, which is very, very important part of it. So this is all from my side. That what is the phytomedicine, how is it going to work, what the prevention has to be taken, what the future work is happening, the genetic profiling is happening, which has to be taken care. So thank you so much once again, Dr. Elizabeth, Dr. Supriya, Dr. Anuja, and all the wonderful people for inviting me on one of the very, very important subject where still the work is going on. And the results are not there. It is like a cancer therapy. The people are suffering with carcinoma. Still, there are some places people are not able to get it right. So the cure is still there. People are expecting that things will be working out. And today we are shouting it out on this wonderful platform. Yes, yes, we are making a difference, and will definitely make a difference. Thank you so much, and I'm sure I'm on time. Thank you. Thank you so much.
Wow, this is amazing, Dr. Rajput, and thank you so much for enlightening this evening in such a great manner. And I heartfelt thanks to you. Such a tricky topic you have explained in such an easy manner. So thanks to you for your great wisdom of knowledge, and of course, a great namaste to you. Okay. Well, moving to this beautiful, knowledgeable, intellectual, insightful, impeccable. I am losing all the adjectives now. Let's move to the beautiful country, Pakistan, land of culture, tradition, heritage, and of course, lovely chicken yummy biryani. Chairperson, Team Dia Global Private Limited, President of GBPC Trainer, and Global Human Rights Defender, none other than I am talking about Dr. Dia Chaudhary. The floor is all yours to hit.
Thank you so very much, most respected and beautiful Dr. Supriya. Thank you for having me. And thank you for your kind invitation, respected Dr. Inja Malik. And congratulations to respected Dr. Dragon and Dr. Elizabeth for organizing this successful event to provide awareness about such an important and important topic. Good morning and good evening to all of you most respected and inspirational personalities from all over the globe. Today I want to discuss about sickle cell anemia. Each year on June 19, countries all over the world celebrate World Sickle Cell Day, which was initially presented as a resolution by the United Nations in 2008. The goal of this day is to recognize sickle cell anemia is a public health problem and promote education about this genetic condition. World Sickle Cell Awareness Day, observed on June 19 every year, is an awareness holiday that aims to increase public knowledge and provide an understanding of sickle cell diseases, SCD, and the challenges experienced by patients and their families and caregivers. Roland Scott, Dr. Scott has been celebrated as the father of sickle cell diseases in the United States and completed groundbreaking research as the advocate for his patients during a time of discrimination. For Sickle Cell Day 2020, we organized people to worldwide to raise awareness of sickle cell amongst friends, family, and colleagues to raise awareness about the diseases worldwide. The four major symptoms of sickle cell anemia. Anemia, sickle cells break apart easily and die. Episodes of pain, episodes of extreme pain called pain crisis are a major symptom of sickle cell anemia. Number one, swelling of hands and feet, frequent infections, delayed growth, and vein problems. Age sickle cell started, people with sickle cell diseases, SCD, start to have signs of the diseases during the first year of life, usually around 5 months of age. Symptoms and SCD are different for each person and can range for severe problem. The four types of sickle cell anemia. The four main types of sickle cell anemia are caused of different mutations in these problems are main four problems: hemoglobin SS diseases, hemoglobin SC diseases, hemoglobin SP plus beta thalassemia, hemoglobin SB plus beta 0 thalassemia, hemoglobin SB, and hemoglobin SE and hemoglobin SO. How to manage a pain crisis: drink water of other when your symptoms starts and can help you head off the worst of any attack. Use a heating pad of bed and take a warm bath. Try massage or relaxing technique. Do something to take your mind off your pain. Thank you for your attention. Thank you so very much and congratulations to all of you.
Thank you, Dr. Dia. It was really great and it was really profounding to listen to you on such a very insightful topic. And it's always been, a great thing, a lovable thing to listen to you in such a great manner. So once again, heartfelt thanks to you. Thank you so much. Well, now it's time to It's time to move to UK once again to hear Claudine Matthews. She is a registered dietitian and nutrition consultant in sickle cell disease. So let's welcome her and hear her once again. Dr. Claudine, the stage is all yours.
Thank you. Thank you so much. It's been really insightful being part of this conference and to know that there's so many people listening around the world. So just to say good morning, good evening, good afternoon, wherever you might be. It's really lovely to be here. I will just point out I'm not the doctor yet. I'm very close to finishing my doctoral thesis, and but hopefully I can shed some insight on the topic of nutrition in sickle cell, which is actually the topic of my doctoral thesis. I'm going to share my screen. I put together a little presentation, but I'll just say this, that nutrition in sickle cell, it's wonderful to hear everybody say something and acknowledge nutrition in sickle cell. And my focus and approach towards nutrition in sickle cell has been slightly different to what has been shared with others, sort of, you know, that's just gone. And it is about how can we change policy and practice to actually make nutrition part and parcel of standard care. Because what I don't want to happen in 2, 3, 5, 10 years' time is for us to have a wonderful conference like this, and we're still talking about nutrition in sickle, but not part of standard management, and something that the patients themselves have to fight for. So I've taken it upon myself through my doctoral research to actually focus on the policy and practice side, so that hopefully moving forward, our patients, when they go and see their doctors or their GPs or wherever, whichever, you know, however you do it in your country, that you will have the confidence and the opportunity to ask questions around your nutrition. It shouldn't be something that you have to fight for. It should be something that's part and parcel of your standard care, just as you would if you needed blood transfusions or hydroxyurea, that nutrition be part and parcel of the standard care that you receive. And so my presentation will be around that, to just elicit and enlighten you on the work that I have been doing. And just, I guess, again, to reinforce that nutrition in sickle, and it's wonderful. This conference is amazing because you're all acknowledging the role of nutrition as part and parcel of standard care. But for so many people, they don't actually know the link between nutrition and sickle cell. And so a lot of my work and through my research, I'm actually trying to do that as well, so that everybody, not just the people in the know, not just people with an interest in sickle, but everybody will have a greater awareness and understanding of the nutritional implications as part of sickle cell disease, and not something that's separate. So I will now share my screen and go through my presentation. Hopefully I can, right. There you go. So as you can see, and as I've been introduced so kindly, thank you. My name is Claudine Matthews, and I'm actually a dietitian by background. And as I said to you, my area of interest is nutrition in sickle, but specifically from a policy and practice perspective. And my research aim has actually been to integrate nutrition into sickle cell. So I thank Dr. Augusta for giving me this opportunity to speak specifically on nutrition in sickle. And as I said, I hope that you will find this helpful and interesting. So there's a couple of things I'm going to talk about. I've got 10 minutes. I'm going to try and stay within the 10 minutes. So a little bit about my interest in sickle, how it came about, because I think that's quite helpful to give you some insight in that. I'm going to talk about the causal link, the nutritional implications in sickle, and then the last part of the talk will be around the importance of nutrition and a little bit about my research. So how did I come about to work in the area of sickle cell? I was introduced to sickle cell in 2011, and in 2012, I accepted a role to work as a social liaison officer in a sickle cell service in the hospital where I worked. And this was because there was high readmission rates of patients to the hospital, and they wanted my role to help reduce that. And the role specifically was looking at supporting sickle cell patients who were experiencing social problems. But it was interesting during that time that being a dietitian, that there was no nutrition services available to sickle cell patients, and the patients were not referred to the dietitian. And so I had no idea that there was a nutritional link in sickle cell at that time. But in 2014, I read an article that was written by a dietitian about acute trauma as an emerging specialty in dietetics. And essentially what she was saying is that nutrition can actually help acute trauma patients, to improve, to reduce their length of stay, to recover quickly. And when I read about acute trauma, all I saw in my mind was what was happening in the blood vessels of sickle cell patients when they experience sickle cell crisis. And for me, it's quite a traumatic experience. So I felt that if nutrition could help acute trauma, then why can't nutrition help sickle cell patients when they're experiencing a crisis? And at that point, I decided to look into nutrition to find a bit more and see if there was any role and scope of nutrition in sickle cell. So through my travels and my work and my reading, I actually did a cross-sectional survey with dietitians just to understand what was already happening on the ground in terms of the nutritional management of sickle patients. And what came through the survey was that there was this overwhelming poor knowledge about nutrition and awareness about nutrition, certainly with the dietitians, but there was also poor nutrition resources available to sickle cell patients, and that there was no nutrition or very limited nutrition service provision available to sickle cell patients. And this was echoed in the findings of my doctoral research project. So for me, looking around the topic of nutrition, it was only now seen as an emerging public health problem, nutrition that is, as a public health problem in sickle cell disease. But we have over 60 years worth of existing scientific evidence that's been done on the role of nutrition in sickle. And therefore, the only conclusion I can come to is that nutrition is an unmet need for sickle cell patients. It's a growing health inequality, and it's negatively impacting the health outcomes of the patients. So what do we already know about sickle cell? We know, because we've heard the speakers already say, that there's medical implications, and we heard Dr. Corona and we heard some of the other doctors speak about the clinical features of sickle cell disease, but there's also the nutritional implications. And although the medical side is really well established and really well developed, the nutritional management of sickle cell patients is certainly overlooked. And nutrition, as I said in the beginning, is not part of the standard care provision for sickle patients. And this means that sickle cell patients are at risk of poorer outcomes because the nutritional needs are not acknowledged and therefore not managed. So this slide is really important because this gives you that linking, that causal link between the clinical features which Dr. Corona already spoke about, the clinical features of sickle cell and nutritional implications. And I've highlighted the three main ones. So the first one is chronic hemolysis, and all that is, it's the rapid breakdown of red blood cells. Normally, for non-sickle patients, the red blood cells will live for about 120 days, but for sickle cell patients, that's markedly reduced to between 16 to 20 days. And so that means that sickle cell patients have to make their new red blood cells on an enhanced and a continuous basis in a short space of time. And it means also that they need more nutrients on an ongoing basis to be able to make those new red blood cells. But in addition to having to make new red blood cells, sickle cell patients suffer from what's the chronic anemia and fatigue. And again, Dr. Corona has already mentioned that. And there's a study that's just come out called the SHAPE study that was done, I think, last year, where they interviewed or surveyed 1,000 sickle cell patients across the globe, and 90% of the patients reported anemia and fatigue being a big problem for them. So certainly anemia and fatigue, I said, increased red blood cell turnover, increased oxidative stress, which results in this chronic inflammation. And so you can see just with that clinical feature already, the nutritional implications for sickle cell patients. The second one is vaso-occlusion, which is also commonly known as sickle cell crisis. And this is the blockage of small and large blood vessels, which results in the painful crisis that many patients have to go to hospital for to be managed. And Dr. Kim Bukwe mentioned about sort of the other alternative measures that you can do to try and reduce the painful crisis. But this results in ischemia, which is a reduction in blood flow in the cells, and also infarction, which is a blockage of blood flow. And all of this cumulatively leads to chronic inflammation at the cellular level, tissue level, and then long-term can lead to organ damage. And then thirdly, impaired immune function. And again, Dr. Corona referred to the spleen of sickle cell patients not functioning optimally. And so these patients are at an increased risk of infection. And when you have infection, you have increased requirements for nutrients. So that increases your risk of malnutrition, but can also then contribute to this chronic inflammation that we find in sickle cell patients. So sickle cell nutrition in sickle is not a simple thing. It's not just about the food side, it's quite complex. And there's a number of indications, and I've already mentioned a few of those indications that we need to pay attention to. And so, as I already mentioned, the infection risk, the malnutrition risk, many patients, and I found this in my research as well, they have poor appetite because of the upregulation of the, interleukin-6 pro-inflammatory marker. So that suppresses the appetite, and that can, if it's prolonged, can lead to weight loss. Patients may need extra support with wound healing, particularly those with leg ulcers. Patients can have a stroke, young children can have a stroke, and that can also require additional nutritional support. Patients can end up with renal failure, needing liver transplants, pulmonary hypertension, cholecystectomy, removal of the gallbladder, and they can have other gastrointestinal side effects as associated with the pharmaceutical management. And so you can see there's many indications for nutrition in sickle. So it is quite complex. And then on the management side, it's looking at the macronutrients, so the energy, the protein, fluids, fiber, but it's also looking at the micronutrients. And again, Dr. Corona mentioned some of them. So zinc, selenium, certainly in regards to how well the body's immune system is working, the vitamins A, C, and E, the known antioxidants to try and reduce the effect of the oxidative stress, which I mentioned about in terms of chronic hemolysis. Then the vitamin D in terms of bone strength as well, and calcium, but also in terms of enhancing how well the immune system can work. Folic acid, we've heard already, and many patients are on prophylactic folic acid. And then omega-3 in terms of inflammatory, and as an anti-inflammatory. And we mentioned about iron as well. And for some patients, because of the treatment that they have, they can actually have iron overloading that builds up in their tissues, in the heart and in the liver. So some of them may actually need to reduce the amount of iron that they have, but iron is definitely an important nutrient, a mineral in terms of making new red blood cells, but we have to exercise caution in terms of iron as well. And so the importance of nutrition is around the fact that not only does it affect infants or pediatric patients and transitioning adolescents, but it affects everybody across the life course. It affects adults, it affects the elderly, it affects pregnant moms as well. So we need to consider and take a wider perspective to how we understand nutrition in sickle cell. It adds a cost and a health burden to patients as well. So if we don't look after the nutritional needs of patients, that can lead to worse health outcomes, clinical outcomes, which can sort of obviously add to that health burden and so forth patients experience. But also it's multifactorial. So it's not just nutrition, it's not just the medical side of things. It is, as the previous speaker, Dr. Chowdhury, mentioned about the psychology, how sickle cell affects patients in terms of depression, anxiety, but also the wider determinants of health in terms of where do they live, the housing, can they afford to buy food, so it's the socioeconomic side of things. So when you're looking at nutrition, you have to look and take a multifactorial approach to the problem and not just focus on the food side, although that is an important part, certainly in a phytomedicine conference. So when we don't pay attention to nutrition, the patients have to self-research what they know. They have to self-manage their nutritional needs, which is what I've experienced or found in my doctoral research. There's poor referral rates of patients to the dietitian. There's limited dietetic involvement. And because of that, there's limited nutritional assessments for these patients. Nutrition is overlooked. But more than that, there's a general rather than a tailored approach to managing the nutritional needs of sickle cell patients, and we have to change that narrative. So coming back to my doctoral research project, which I started in 2016 as a self-funded doctoral program, and I'm very happy to say that I'm submitting my thesis tomorrow on World Sickle Cell Day. So I'm really excited to have reached this point after 7 years. But anyway, so the vision for my research, my doctoral research project was so that all sickle cell patients can have access to nutrition service provision as part of their standard care. The mission for me is to increase policy and practice development to integrate nutrition into standard care provision for patients. And the goal of my research project was to co-develop a whole systems policy and practice strategy to support the integration of nutrition into standard care to improve patient outcomes. So this is just some of the feedback from the comments from the findings of my research project, which both the providers and the service users that I had as participants mentioned. They said nutrition is fundamental. It's an important part of their mental health. Nutrition is never mentioned. The patients have to do their own research and nutrition is overlooked. So we have to pay attention to what our patients are also saying. This is just my call to action. So I've written articles, publications. I've written the first ever nutrition standards for sickle cell in the UK. Obviously done doing my doctorate. I put on nutrition conferences. I have helped with school education campaigns. And so that's my call to action, but our joint call to action is to place patients at the center of care provision and planning. And that means that we are all called, and I think the speakers prior to me have already alluded to the fact that we have to do it collaboratively and in partnership. We can't do it in isolation. So this conference is wonderful that we're drawing on knowledge base across the world, and that's fantastic. We need key stakeholders in the space of nutrition in sickle and in sickle cell specifically to come together to talk, to contribute to policy and practice. But importantly, we have to mandate nutrition as a priority, which was already mentioned. And that's the end of my presentation. So thank you so much for your attention and for inviting me. And I hope that you were able to take something helpful and useful from my presentation today. Thank you.
Claudine, this was really, really marvelous, ravishing, and mind-blowing. And when I was listening to you, I remember only one thing, that your diet is a bank account and good nutritional food is your right investment. And dietitian, if I say, they are just like next God to us, who shows the path, who, lead the path. And if you're listening to a dietitian, we are saving a life. So keep listening, Claudine, and all the best for your future, for your endeavors. God bless you. Keep rocking.
Thank you. Thank you.
Well, after UK, now we are landing to beautiful country, Croatia. And whenever I say Croatia, I am talking about the very talented Professor Nada Radkovic. She is the president of IIU Research Center, professor, educator, global speaker, and a very great quality. She is a very humble person, my dear friend. So let's hear her. The stage is all yours, Professor Nada.
Thank you. Thank you so much. First, my gratitude to respected Dr. Dragan, respected Dr. Elizabeth, to you, great Dr. Supriya, and to respected Dr. Anuya. I'm really honored to be here today. And yes, I want to say I learned a lot about this very important topic about the phytomedicine as adjuvant therapy in treatment of the sickle cell anemia. Coming from Croatia, now I want to say it is the time summer is already here. I think that you need to think about your vacation, summer holiday. And this year the topic is building and strengthening the global sickle cell communities. Croatia is a beautiful country. So I have something a little different that I want to show today. So let me can I share, Dr. Supriya?
Yes, you can.
Okay, thank you so much. So my topic is case study in Croatia. We are a beautiful country. We are a really rich country. We have so many natural beauties. So let me start. I have a little small laptop. So I need to first I need to no. So I want to show the medical plants and traditional herbal products from Croatia. Dr. Dragan is nearby me. So here you see, we need to come to the nature. This sickness, the sickle cell, this is a very, I can say, a big problem. So we need to go to the nature and try to find all from the nature. In my country, we have this big medical herbs. We have more than, I can say, 50,000 natural things. So we are taking care about all the illnesses. So let us see. Dr. Dragan also is doing this. I enjoy always when he show his medical herbs. So let us move here. I want to say that this aloe vera. Aloe vera is very important. We can make tea, we can use it in the cooking. So she's really a queen of the medical plants. She looks like a cactus, and she has all the vitamins A, B1, B2, B3, B6, B9. We need that for us. That will give us the strength for our heart muscle, for asthma, for allergies, for all illnesses. Also, the Mayo Clinic is suggesting you, because the good science and experts are thinking on the same way. But I want to say that it can be used for our beauty. We can make so many recipes, like combining honey and aloe vera for the face mask. We women like to make this masks and to take care about us. So here is one recipe: 1 tablespoon of honey, 3 tablespoons of the aloe vera. In Croatia, we have this priest, and this recipe goes through the world. He's preparing it against cancer. So not only against cancer. So today we are talking about this sickle cells, and we also it is very important. It is important to use this. We can do it every day, and you can have it in your garden, and it is very easy to make. So the recipes to help everybody. This father make it, and really there are so many patients who use this, and who were today live, and who are today, I can say, very healthy. Then we have this lady's grass. So walking through nature, we need to know all these plants. We need to know them, and my niece knows almost all of them, because like a little child, we took her always in the nature on our village, and she was always researching all these plants. So I know that she will do something very useful for the health, not only for her health. She is doing now, making the recipes, making the teas for my mother, for my father, from all these plants. Then we have this stolly snake, chamomilla. We need to use her. So many tea. Let us move from the coffee and all drink only the tea. That is my suggestion. Then lavender. This fields of lavender. The fields of lavender can help us for the headache, for the migraines, for stimulate the digestion, and for all types of the asthma. We are today under the stress. Let us reduce our stress. Then the mint. The mint is helping us for the mental resilience. Cadula, called sage. We have a big Adriatic Sea. This cadula is by the sea. So for all this antibacterial, antifungal actions. So think about this Smilia, this immortal. We don't have immortal everywhere. Croatia is famous for the immortal. So this is something why I want to motivate you, inspire you to come to visit my beautiful country. And we can go to the we can go to the sea, we can go to the lakes, we can go to the forest. So, and we can all make this. And I can say I would never sell this. I will give this to the people. When my aunt and my relatives come from USA, this is our gifts for them. So Croatia medicinal herbs, thinking about this, how to make them. We need all this. We need modern technology for this. Dr. Dragan has all this. He's making it. So we can help him for this. Taking this, sharing this, replacing this everywhere. So let us. This is always I want to say, protect all the plants all around the world, not only in my country. This can be a great business, but if it is a humanitarian work, it is more better. It has a better value. So this is Croatia stars. Only Croatia has this Velebit Degenia. She is also very medical. And runolist, we have this runolist. It is also very medical. So my student, this is not my subject. I'm not in the field of medicine, but I have one subject called consumer responsibility. So we took activities and we learn about all these plants, because I think this is very necessary for them to know everything. So medical plants and herbal products in Croatia have a long history. We can make a lot of products. Even I can say that we don't use this how much we have on our sea, islands, mountains, fields, and lands. So when you go for a walk in the nature, remember that plants protect you. Take care of them too. Protected plants have a place in the nature, not in a vase. So I have a beautiful garden. I never took my roses and my plants in the vase. Thank you for your attention.
Professor Nada, I am speechless.
Thank you.
After watching this ravishing and eye-catchy presentation. And I'm sure all the people who are watching your presentation, wow, everybody would love to visit Croatia. And my next
Thank you
trip
so
will
much.
be and my next trip will be Croatia for sure, because really your country is beautiful and so many medicinal plants, flowers. It's really a great
Yes. Yes.
awesome one.
You are most welcome. You are all most welcome. Thank you. Thank you so much. And I'm really honored and grateful to be here today. Thank you.
Much gratitude. Much gratitude. Well, ladies and gentlemen, after this, eye-catching flowers of Croatia, which was really spellbound, and we were all, mesmerized and looking at those medicinal plants. Wow, this lavender, which I was thinking it's just a flower, can do a lot of miracles. And it was so great to watch this. Well, moving to our next speaker, it's the time to move to Saudi Arabia for our next prestigious speaker, David Oyo, Regional Surveillance Coordinator, General Directorate of Infection Prevention and Control, Jason Sickle Cell Warrior, Advocate and Author. Please welcome. The stage is all yours, David.
Good evening, everybody. I hope you can hear me. Yeah, okay. I'm presenting from Jizan in Saudi Arabia. I'm a medical doctor. I'm from Nigeria. Interestingly, Nigeria is known to have the highest burden of sickle cell disorder in the world. Statistically speaking, 25% of the population of Nigeria are described to have at least a trait of sickle cell anemia or sickle cell disorder, either the A or the S or the C trait. So Nigeria stands as the highest burden of sickle cell disorder globally. And interestingly, Jizan, the region I'm in Saudi Arabia, is known to host the highest population of sickle cell disorder and blood disorders. So I think those two strategic locations are timely for this presentation. I am going to be sharing from my experience as a sickle cell warrior and as a medical doctor. When I say sickle cell warrior, we use that term to define or describe people that live with sickle cell disorder. I may have to share some slides so that we can follow me through to see what I have to present. Okay, can I go ahead?
You can.
Can you see my slide?
You can share.
Okay. Okay, can you see my slide? Okay, so there are some variants of sickle cell disorder, which I won't want to talk so much about the origin of sickle cell disorder because a lot of people have spoken about that. But one of the things we need to know that I need to reiterate is that it's an inheritable or genetic blood disorder. How is sickle cell disorder detected, medically speaking, either by hemoglobin electrophoresis or high performance liquid chromatography? Variants of sickle cell disorder, we have sickle cell traits. I want to highlight about sickle cell traits, AS or AC. While in medical school, as a medical doctor, I was taught that people with sickle cell traits are often asymptomatic. But when I published my first book on sickle cell disorder, A Life with Sickle Cell Anemia, a lady in the UK read it who has sickle cell trait, and she reached out to me that most of the things I describe in the book, she experiences them. And I asked her, that cannot be possible. Are you sickle cell anemic? Do you have ASS or SC? She said, no, she's AS. And she has done many tests repeatedly in the UK. She's from Zambia and she currently resides in the UK. And the test shows that she's AS, but she has been having most of those complications and crises, like the pain crisis, other complications of sickle cell disorder. And I was surprised because what I was taught medically was that people with sickle cell trait or sickle cell carriers are asymptomatic. So this is a more reason why we should open up our mind and invest more into research into sickle cell disorder. Sickle cell disorder was one of the first genetic disorders to be detected globally, but unfortunately, sickle cell disorder is the most under-researched and underfunded disease or genetic disorder in the world. Talk about hypertension, talk about HIV/AIDS, talk about many other conditions. There are many researches into them except sickle cell disorder. And that is why it's very important we keep collaborating and speaking that more research to be invested, more work to be done into sickle cell disorder. Quickly, so I want to move to the next slide. The history, here it talks about the history of sickle cell disorder. We could see there, the first time it was detected scientifically was from Walter Clement Noel, a young Black man from Glendale Island. And the description from the microscope from his blood cells showed crescent-shaped red blood cell. 1904 was when sickle cell disorder was detected, but there is still little research as regarding sickle cell disorder. How is sickle cell inherited? I know people have spoken about it, and I won't want to tell you so much on that. So what are the triggers of sickle cell disorder? Stress, which could be physical or mental, infection or infestation could be bacterial, viral, parasitic. Most of the time, we often had malaria infection triggers, pain crisis of sickle cell disorder, and many other crises. Even COVID-19, any other form of infection can trigger it. Dehydration, that is why it is informed that people that have sickle cell disorder should consume more fluid, more than people who do not have sickle cell disorder. Extremes of temperature, either the cold or the hot temperature, hypoxia, when there's reduced oxygen in the body. That's why it's advisable for people with sickle cell disorder not to dwell in regions where there is high altitude because of the low oxygen. Oxidosis, when there is high acid in the body. So I want to quickly talk shortly on the crisis of sickle cell disorder. These are what medical information talk about, but I won't be surprised if you discover that there is still much more because sickle cell disorder over the years has been under-researched. Hemolytic crisis whereby the red blood cell breaks down. There are two reasons for this. One, the lifespan of the sickled red blood cell is shorter than the normal red blood cell. Normal red blood cell is biconcave in shape. The sickled red blood cell is sickled in shape under certain conditions. The normal red blood cell has a lifespan of 120 days, while the sickled red blood cell has a lifespan of either 10 to 20 days or at times 60 days. So that is one of the reasons because the lifespan is short. Secondly, the sickled red blood cells are frequently broken down in the blood. Why? It's an organ in the body the spleen that is responsible for the immune function of the body. It is the largest organ in the body responsible for immune function. It identifies the sickle red blood cell as an abnormal or foreign entity in the body and then mops it up. So the frequent mopping up and destruction of the sickle red blood cell is another reason why there will be low reduction in blood, causing hemolytic crisis. Basically, crisis called the pain crisis. It is the commonest crisis most people present in the hospital with. You are seeing somebody that is first diagnosed with sickle cell disorder presenting in the hospital because of the pain crisis, and the pain crisis can occur in any part of the body where blood flows. I could have used 3 examples to describe it, but because we have more women here, I want to use pregnancy to describe the pain crisis of sickle cell disorder. As a medical doctor, I understand managing women who are pregnant and at term, ready to deliver. The pain crisis of sickle cell disorder can be described to the labor pain a woman feels at the point when she's at the point of delivery, when she's having acute contractions, active labor pain, and the contractions she's having like at least 4 contractions within 10 minutes. Each contraction is lasting for more than 2 minutes, and then the cervix, where is the birth canal part where the baby comes out from, is fully dilated, whereby the baby can come out. So the pain that woman experiences, whereby it messes up her mind, that is the same way people with sickle cell disorder experience pain crisis. But you see this discrimination when you present to the ER or the hospital, because you are not shouting or wailing like a woman in labor pain, or you are not shouting or wailing like a person with bone fracture. They think you are not really having pain, and they do not attend to you quickly. But the issue is, because you've tried many attempts to manage the pain at home and nothing succeeded, you're already exhausted and tired. And so you cannot shout, but you are still having the same kind of pain in the same kind of severity like somebody that is pregnant or somebody presenting with a bone fracture. So there's also sequestration crisis, whereby the spleen continues to mop up the sickled red blood cell and suddenly it gets enlarged. After some while, the spleen gets shrunken, and then in people with sickle cell disorder, you discover that there is no spleen, or the spleen is already reduced. And when you try to palpate for where the spleen is, you will not be able to detect it. Also, there's ablastic crisis. Nowadays, because of advancements in medicine, you don't get to see cases of ablastic crisis. And then acute chest syndrome, whereby the person will be breathing frequently, gasping for breath, and then the person could be mistakenly presenting in the hospital as if he or she has pneumonia, but it's not pneumonia, it's an acute chest syndrome. One of the things that could help to tell that, oh, you will see that the person already has jaundice. So let me quickly talk about some of the complications so that we'll be able to know. One thing I want to say is this: because of the nature of the problem in sickle cell disorder, it is the blood that is affected. Every part of the body that blood supplies, they can be affected. Any organ, starting from the crown of our head to the sole of our feet. And so those are the places where you often see complications of sickle cell disorder. Sickle cell disorder causes delayed puberty. I experienced delayed puberty, and my younger brother was growing taller, matured more than I. And so this also causes discrimination. When you are going to an event and you look shorter than your age, and people try to send you off or wade you off because they think you are not fit for that event because of delayed puberty and stunted growth. Sickle cell disorder also causes dactylitis, called hand and foot syndrome. I presented with this as a child when I was growing up, and it was my first reason for admission in the hospital, and I was transfused with blood. So what happens is that the hands are swollen, the feet are swollen, and it's very painful. Priapism is a painful, purposeless penile erection of the penis that is painful. Recently, I was talking to a lady that was involved with other ladies about sickle cell disorder, and one of her siblings has sickle cell disorder, and she was trying to talk about priapism, but she was shy. And then she wrote it on the paper that her brother was having pain in the penis. And I told her, yes, I know what it means. That is priapism. I have suffered it before. And I described it to her like labor pain. And she was furious that her brother started having this priapism early in the morning, but did not tell anybody until it was late in the night. And she was like, why should he endure such pain? And I told her, I understand, because even as a person, it is something shameful telling somebody that you have pain in the penis. So those are part of the problem, sickle cell disorder. Stroke. While I was growing up as a doctor, studying medicine, what I was taught was that the risk factor for stroke occurs in children with sickle cell disorder. But when I got to Saudi Arabia 2 years ago, they did a CT scan and MRI of my head, and they discovered a silent stroke. Now I'm getting to understand that Saudi Arabia has data, credible data, that at least 2.5 or less than 5% of adults with sickle cell disorder have presented with stroke. So that changes the notion that stroke and sickle cell disorder is not only limited to children. Kidney diseases, kidney problem like enuresis. I was bedwet. Enuresis is bedwetting at night. I was bedwetting at night at the age of 10 years. And I never understood that this was due to sickle cell disorder. It was later on in year that I started understanding about this. And when I speak to many parents, I hear them talking about their child with sickle cell disorder also bedwetting up till after 10 years. And they are asking, what can they do? Sincerely, these are all of the areas that also need more research, not only into orthodox medicine, but even unorthodox medicine, alternative medicine, and other medicine that can help us be able to manage some of these conditions properly. Chronic leg ulcer, I suffered chronic leg ulcer twice. Each one lasted for 6 months. And when I spoke with another woman that had chronic leg ulcer, she suffered chronic leg ulcer for 7 years. I can tell you the experience of chronic leg ulcer is really traumatizing. It is really bad. And I just hope we have an answer to how to manage this, because it causes depression on its own. At a particular point, I was open because the leg, I keep pressing it, nothing was happening. Thank you for the dietitian that spoke about diet. One of the things that is often advised when you're managing chronic leg ulcer in medicine is that eating good nutritious food helps you to be able to, helps the wound to be able to heal faster. So I was practicing that and many other things, applying honey, and nothing was working. I even went to the extent of doing wound debridement. And I got to a point that I felt maybe my leg would be amputated, but as God will have it, like the 6th month, it just miraculously disappeared. But those are areas we have to look into. Bone complications like osteomyelitis, infection of the bone, avascular necrosis, spondylodegenerative changes of the vertebrae, and many other bone conditions sickle cell disorder causes. Gallbladder stones, sickle cell disorder causes that. Retinopathy, disease of the eye, sickle cell disorder also causes that. I go for annual eye screening every year. Well, I did annual eye screening for the past 3-4 years, and it was been normal. But this year, when I went for annual eye screening, they detected that I have early form of retinopathy. And so I had to go for laser eye therapy last week. So that is how sickle cell disorder is. Today, there is nothing, and tomorrow you just see something. And that is why there is need for more research into sickle cell disorder. In pregnancy, it can cause premature contraction, preterm delivery, preeclampsia, anemia in pregnancy. It can cause malnutrition, it can cause intrauterine fetal death, and many other problems. There is a condition, chronic fatigue syndrome, that I've seen highlighted in people that have COVID infection. It has been described by WHO as post-COVID, long COVID, or COVID complication. I have also seen it caused by sickle cell disorder because I have it. And I've spoken with many people with sickle cell disorder that also share the same thing. It causes chronic fatigue that does not get relieved with rest. So you get to sleep because you are feeling tired. And then you wake up in the next 4-5 hours and you wake up weaker and you are surprised and you are confused. That is how the chronic fatigue is. Then you have unrefreshing sleep, whereby you can even sleep for 13 hours but wake up unrefreshed. Then it also causes a migraine-like headache, whereby you are having headache on either side of the head. And after it gets prolonged, it could trigger pain crisis. It causes loss of memory. I frequently suffer from this loss of memory that affects my work, affects my relationship with people. Some people, it is loss of concentration. Then it also causes myalgia, causes loss of appetite. Recently, I experienced this loss of appetite. I never got to know that it causes it. I lost appetite for all types of food for almost 5 weeks. And I was losing weight. I was having chronic fatigue daily. And I lost about 4 kg. So when I presented to the hospital for exchange blood transfusion and I asked my hematologist, she confirmed to me that yes, this loss of appetite is also caused by chronic fatigue syndrome, and sickle cell disorder also causes chronic fatigue syndrome. However, sickle cell disorder is not the only cause of chronic fatigue syndrome. Many other conditions also causes it. There is epistaxis, as you can see that picture, when there is profuse nose bleeding. I suffered that when I was a teenager. There is pica, whereby you hit inordinate objects. I was eating sand until I was 18 years old. I've had people that said they were eating charcoal, they were eating foam, they were eating chalk. Those are also conditions that sickle cell disorder causes. How do we get to manage this? We don't even know, but those are some of the problems. Mental problems like depression. 2019, I presented in the psychiatric hospital and I was diagnosed for depression with a tinge of anxiety and so on. I'm on antidepressant. And I want to say this, because of the numerous problems sickle cell disorder causes, there is a need for mental health care involved in the holistic care for people with sickle cell disorder, because sickle cell disorder affects the mind and the body from cradle when you are born till the grave. Talk about when you are having your bedwetting enuresis. Those are potential mental implications for you. Till when you're having chronic fatigue syndrome, you're having chronic pain syndrome and many other conditions. And so it is very important that mental health care is incorporated into the holistic care for people with sickle cell disorder. So those are the complications, some of the complications I can highlight here. Care of sickle cell workers, I'm going to stop with this. The physical part, which is pharmacological and non-pharmacological. Under non-pharmacological, we can talk about nutrition and other alternative forms of medicine, which this presentation tends to address. And I believe it is time we open our eyes and our heart to every form of therapy that is scientifically proven that can help to manage and cure sickle cell disorder. The only cure for sickle cell disorder that we've known over the years is bone marrow transplant scientifically. When are we going to have something else? Bone marrow transplant is not accessible and affordable all over the world, and it's very expensive. So we need to go beyond that. There's also, as I mentioned, for mental care.
Dr. David, can you make it in a time, please? We have another speaker also.
Also, social care support group. There is need for people with sickle cell disorder and their caregivers to join a support group whereby they're able to share their experience and able to talk out and learn from one another. Thank you very much. I hope we were enlightened enough with this presentation.
Thank you, David, for enlightening such a great topic in such a great manner with such an insightful presentation. So hats off to you. I wish you all the best for your future and for your successful endeavors. God bless you. Well, we have arrived to the end of our journey, but it's always the beginning of the journey. We have last but not the least speaker from Philippines, Dr. Joel M. Fontanella, who is an educationist, author, international speaker, global peace ambassador, faculty of Benning Grove, Aldana National High School. Welcome, Dr. Joel. The floor is all yours to rock on.
Thank you very much. It's my pleasure and honor to be part of this global conference. Greetings to all across the globe. I would like to commend all the excellent speakers for today's international conference about the phytomedicine as adjuvant therapy in a treatment of sickle cell anemia. Well, food plays a vital role in maintaining normal function of human body. With the recent advances in medical and nutrition sciences, natural products and health-promoting foods have received extensive attention from both health professionals and common population. It is normally assumed that keeping proper nutrient balance is necessary to maintain good health and that excess may not be benefit or even harmful to health. Phytonutrients or phytopharmaceuticals are more recent terms that refer to a group of natural substances that include certain herbs and such products of plant origin that are used as dietary supplements. They have specific pharmacological effects in human health. Many of these substances have anti-inflammatory, anti-allergenic, antioxidant, and many other therapeutic effects. Phytopharmaceuticals can be added to enhance in natural foods through genetic engineering. An example would be the high lycopene tomato, a genetically modified tomato with delayed repining characteristic that is high in lycopene, which has potent antioxidant capabilities. They have demonstrated to have potential health benefits and disease prevention properties and are known as potential antioxidants.
It's 11 o'clock.
As reviewed in research with evidence about the effects and safety of phytomedicine in people with sickle cell disease of any age or in any setting, sickle cell disease is an inherited blood condition caused by defects in the production of hemoglobin. Hemoglobin is a part of red blood cells that carries oxygen across the body. It occurs when people inherit faulty genes responsible for producing hemoglobin from both parents. A variety of complications and reduced life expectancies are linked with sickle cell disease. Phytomedicines are medicines derived from plants in original state, and the benefits have been evaluated systematically. Laboratory work has long suggested that these medicines may help to ease symptoms of sickle cell disease. Based from the research entitled Traditional Herbal Management of Sickle Cell Anemia, Lesson from Nigeria, patients in West Africa, where sickle cell anemia is endemic, have for ages been treated with natural products, especially herbs, as it is still the case in rural communities. The study raised the hope that search in the tropics for more effective herbal recipes for managing sickle cell anemia will be more fruitful with time and effort. The study revealed that during the last 2 to 3 decades, much progress was made in several aspects of sickle cell anemia pharmacology, especially the approval of hydroxyurea. It was proven that anti-sickling herbs abound in West Africa and that most promising may yet be found. Medicinal plants in the Philippines. Before the advent of formal medicine, people largely depended on herbal plant knowledge that has been passed through generations of families. from the poultices for wounds and bruises to tinctures and concentration oils for disease treatments. Herbal medicines has been around since immemorial. Here in the Philippines, based from the research, there are several problems that continue to plague the Philippine healthcare system. The cost of branded drugs in the Philippines is 22 times more than the international reference prices, while generic drugs are 4 times more. Filipino traditional medicine plays a large role, has been around for centuries, and it's well accepted in rural areas. The practice of herbal medicine in the Philippines has come a very long way. Folkloric use of herbal plants by our forefathers in ancient times have been passed on from one generation to another. In the past few decades, interest into finding scientific evidence have investigated the conduct of basic and preclinical researches. The Philippine government also showed some support by identifying and recommending at least 10 medical plants as beneficial for health. Program was launched by the Department of Science and Technology, or DOST. Standardized herbal drugs have already been developed for clinical testing. Validating the use of these traditional medicine plants through research is essential in order to have an evidence-based practice of herbal medicine. Our Philippine medical or medicinal plants are valuable but often underappreciated resort with innumerable applications for non-communicable and communicable disease indications. Their production has contributed to the revenue and growth of the Philippine pharmaceutical industry, as well as improved the economic status of farmers cultivating these crops. Developing more herbal medicines needed for primary health care would decrease our dependence on the importation of medicine and increase the accessibility of drugs even in a geographically isolated area. Bringing back the herbal medicine gardens to a small place in the rural communities will also assist in empowering the population. The integration of herbal medicines into mainstream clinical practice will only be possible if the researches performed, both non-clinical and clinical, as robust as those for synthetic medicine. Before I end my talk, I will leave a quote from Paracelsus. All that man needs for health and healing has been provided by God in nature. The challenge of science is to find it. Thank you very much and have a good day.
Thank you so much, Dr. Joel, for enlightening us today with your great knowledge and great wisdom too. And once again, you told about your Philippines and its medicinal, phytomedicine. That was really, really great to listen. And I have no words to describe your versatility. Thank you so much. Well, ladies and gentlemen, I will say only one thing to you all. That is, life is a journey. Enjoy the trip. Aim for the sky, but move slowly, enjoying every step along the way. It is all those little steps that make the journey complete. And the journey is rewarded. Stay patient and trust your journey. And I hope you all have enjoyed today. You have taken any number of key takeaways, especially on this topic, sickle cell anemia and phytomedicine. I express my gratitude to all the speakers, live audience, and of course, my team, Dr. Dragon, Dr. Anuja, and Professor Augusta, for their everlasting love and support. Thank you everyone for making this conference again a special mega blockbuster. You will be getting your certificate today itself, so no more delays in that. Until then, stay happy, hail and hearty. Bye-bye from India. Bye-bye, everyone. Bye-bye.
Thank you. Thank you so much. Thank you, everyone. Thank you.
Thank you so much, Dr. Augusta. Thank you,
You're
Dr.
welcome.
Dragon.
Thanks. Thank you, everyone. Thanks for coming today. Don't forget, tomorrow is June 19, World Sickle Cells Day.
Yes, exactly.